Hey guys, we are really excited today to be here with Dr. Patrick Mahaney. He's grabbing his coffee. We're letting folks come on in. Hey,
Hi.
Dr. Patrick, how are you?
I have coffee, but I don't have a cat.
Not like on hand or at all?
I'm sorry, no, I do not have a cat of my own to share. I used to have cats when I lived in Washington, D.C. back in the mid-2000s, but since then it's been one dog who unfortunately is not with us anymore. And I'm kind of actually on a little bit of a break between pet ownership because I spend so much time with clients in their homes, like 5 to 7 days a week. I'm with people and their pets. And sometimes my husband, Phil, and I have my patients come and stay with us for days to weeks to months at a time. So I kind of it's like a extended fostering situation at times. I don't really need to have a pet of our own right now, but I do look forward to having another pet and more cats in the future.
Yeah, I mean, ownership looks a lot of ways, right? There are some people who own the neighborhood cat and he has like 5 families. There's, and the most fun thing we always see those stories like on social media about like the cat that has the note that's like, "Don't feed me, I have a home."
Right. Yes. Getting plenty of food from other good Samaritans around the neighborhood.
As they do. But, you kind of mentioned it already. Because of the nature of your business, you sometimes bring cats into your own home. But that's what we're talking about today is your very unique practice and the way that you are giving your skills to cats. It's kind of untraditional, but it's one of the things I'm the biggest fan of, and that's these house call visits, right?
Yeah, absolutely. I mean, I've been in practice for 20 years. I went to University of Pennsylvania, finished in 99, did a variety of practices and ended up in LA in 2006. And I was going through veterinary acupuncture training at the time. I've always wanted to have my own business. My plan actually was to be a veterinary radiologist, but it didn't match for residency programs. You go to veterinary school, you graduate, and go right into practice. If you want to become a specialist, you generally need to do an internship. You do your internship, you try to match for residencies, of which there are very few in the country, especially in radiology, and I didn't match. And so I just started going to practice. And so I've always wanted to live in Southern California. Ultimately, I had a job bring me here in 2006. And after I finished my acupuncture training, as I was finishing my acupuncture training, I was driving around, taking my dog to dog parks in the Hollywood Hills, and I'd see all these mobile businesses for pets, groomers, other mobile veterinarians, dog walking services, etc. And I had an aha moment where I said, I just need to have my own house call based veterinary acupuncture practice. So I really just started California Pet Acupuncture and Wellness as an acupuncture, herbs, Chinese medicine, nutritional consultation practice, then really needed to add more services over time. Like the other pet in the household needs services, I would get great referrals to clients. And I just basically kept on working in that capacity, adding more services, becoming essentially like a holistic wellness and illness type practitioner. I'm actually right now striving to move a little bit away from acupuncture because it's a very physically demanding process. And I've got some own like mobility issues of my own. And so I'm just trying to kind of take a different approach, but I love the fact that I can go to the home, see exactly what's going on with the pet, check out the home and the yard, interrogate all the people in the household to find out what they're doing to potentially negatively contribute to pet health, because it happens all the time. Like, especially in LA and the communities I work with, a lot of times there are household helpers, and those household helpers may be doing a different plan than I create for the client or the client creates for their own staff. So it's really good to make sure everybody's on board doing the same thing. And cats are so stressed by getting into the carrier, going into the car, getting into the hospital where it's scary sights and smells. So it's really better if they could have certain treatments at home. Of course, sometimes I have to partner with area hospitals to do x-rays or hospitalizations or surgeries or ultrasounds. So all sorts of things can happen with specialty practices too, but so much can be done at home that really benefits the cats. They don't have to go through all those stressful experiences. So that was a very long answer to a question that I think you asked.
That's and how we're done. No, that was perfect. That was the perfect answer, because that's exactly right. It's like, why is this important and how does this work into the everyday life? And I love that you have a partnership with local veterinarians where you can do the thing, because it's all about this team effort, right? As a veterinary technician, I have to know the specialists in my area. I have to know the pet sitters in my area. It's a team effort. It takes a village, to raise our kids, our fur kids. And we know. So as a coach, I am so often like, send me pictures of your litter box. Send me pictures of where the food bowls are. Tell me more about this situation. And you can really get into the nitty gritty of what's going on in the household, because the cats won't tell us. And, it's funny, in the veterinary side, we always laugh. We say a cat's normal heart rate, respiratory rate, temperature is only measured in the clinic. And it is not fully representative, we know, of what goes on in their day-to-day life. So we're really doing like better medicine in the home, right?
I feel a lot of ways that's the case. Just because, even also like blood pressure, you're trying to get an accurate assessment of blood pressure, even glucose curves. Usually by the time my patients are needing glucose curves, I'm partnering with an area internal medicine specialist, because they kind of drive that boat a little bit better than I do. So anything that could be done at home, that can be done at home for cats, really should, if we're able to do that. Of course, house call services are more time consuming and more expensive, so it's not the right model for everybody. But it's a great model for convenience, for the overall health of the pet. And just what you're saying, like the things you can see when you're in clients' homes, like the number of times I've seen toxic plants around households that these cats could get into, or ways that they could escape from the house and get into the yard and get out of the yard, or the predators that are lurking nearby. I mean, in the Hollywood Hills where I work, there's coyotes, there's falcons, there's rattlesnakes, there's all sorts of things that could really negatively impact cat health if you're not really thinking ahead a couple steps and really trying to educate the client as best as you can to keep their beloved fur baby safe.
Sure. And like the owner experience is to be noted as well, right? So my mom has one of those kitties who is vocal about her feelings at the veterinary clinic and screams at the top of her lungs. My mom is like horrified when this happens. She's probably watching, right? Shout out to my mom. She's my greatest fan. But like, she's horrified and she's like embarrassed by it. Now when the vet comes to her house, shout out to her vet, Dr. Kirsch, in Chapel Hill, she comes all the way down to mom's house, and one, has really, like you said, identified areas that there's an issue, but two, my mom has a better experience. My mom has that human-animal bond moment with her pet, right? Where she doesn't feel, how often do we hear people say, I feel like a guilt moment around going to the vet?
Certainly. And even now, I mean, veterinary practice is changing. Veterinary practice has been changing from the early 2000s with the advent of the internet and owners being able to get information online and source products and things like that, which is really good, I think, for the most part, because I want people to be as educated as possible. Of course, we have to kind of filter through the information so they're not always chasing the zebras when they should be chasing like the more common problems that could be occurring. But now with COVID, if you have a veterinary hospital, you are not going into the hospital as a client. You're going to the parking lot or whatever other area outside the hospital. Somebody from the practice is coming out to meet you and talk about your pet, and probably ahead of time you've given some kind of history through a document that you print or fill out online and submit. And then you're not often even interfacing directly with the doctor. You're getting a phone call from the doctor. So it's changing right now as we speak. And certainly that might be even better for the owner in some way, like the process of having to take your cat into the hospital, sit in the waiting room, you're stressed, the dog is barking over there, the cat is getting more stressed. You can just kind of pass the cat off to hopefully a trusted technician, and things get done, and then you stay safe and a little less stressed.
Yeah. Okay, so speaking of COVID, how's this working for you going into people's houses? Are you, I saw this thing, a little girl built a hug shelter, a hug filter thing for her grandma's house with, she made armholes in a plastic. And I was thinking, that's what Dr. Mahaney needs. It's just like a little plastic shield you can stick your arms in and do your vet thing. How are you doing this in this time?
Well, if I really had a strong concern that a client of mine was ill, I wouldn't go into their household. And for the most part, I have a really good stream of communication, actually ongoing streams, sometimes a little too much with clients where I know what's going on with them. If they feel like they're ill, I wouldn't put myself in harm's way. But I've always been really fastidious about kind of my own health, and then also just healthy habits, hand washing, not touching my face, things like that as much as possible, at least. And so going to clients' homes now, I'm wearing my face mask, I'm wearing gloves, I'm sometimes wearing eye shields and foot covers. I'm even seeing appointments outside now. It's a little more challenging with cats because cats have that greater propensity to escape. So I generally prefer a indoor location, maybe not one that people come in and out of, like a side office, a casita, a garage, but also driveways, porches, gardens, decks, backyards, all sorts of things. So I'm really practicing very similar to how I used to. I'm actually perceivably busier than I was before. People are home. They're noticing more things about their pets. People are getting new pets. I always have new clients coming out of the woodwork. I really, right now in Los Angeles, just work on a referral basis, but it just keeps on building and building and building. And people, I think, are really just appreciating the house call model because they're scared to go out. And if I'm willing to come to them, hopefully I can at least provide them with a little sense of relief. Yeah,
that's so true. It's such an unprecedented time. And so it's like, well, this wasn't your intent when you started, but it's facilitating a need and helping with people's fears. And really, I think, considering this is a really good option for all of our cat owners. So I guess my next question to you is, how do you help someone find a house call practice in their area? Is there a network for you guys? And how do we vet that, so to say?
That's a good question. So I'm a holistic practitioner. So I'm part of the American Holistic Veterinary Medical Association, or AHVMA. And the ahvma.org has a tool where you could find a holistic vet in your area. So that's kind of one way I direct people, depending on what they're looking for. If they want a more of a conventional approach, then they're probably just going to have to Google for what's in their area. I don't know if there's actually some. I know there are through like Facebook groups, and the Veterinary Information Network has groups where house call practitioners can talk about issues, but they're not really a resource for people to find one. So it might be a matter of Googling, asking other cat owners that in your neighborhood. Maybe if you follow famous cats online, where they live, you can ask who their veterinarian is. Yeah. There's all sorts of different ways you can find them, find somebody that can come and help you.
Yeah, it's a cool model. And what are the things that we want to look for in a house call veterinarian? So like, how can we be empowered cat owners when we're looking for a veterinarian to come into our house? I mean, obviously, that's like a trust thing. And I think looking for a veterinarian in general is like a high stress thing for owners, right? At least for me, sure. I'm demanding, but I've got a great veterinarian. So tell me a little bit about what to look for and how do we know we've got a great veterinarian in general, but especially someone who's coming into our house. Like, what would we expect in that visit that they should be doing?
Sure. I mean, there definitely is a high degree of trust that you have to have with anybody that's coming into your home. That's why I feel, another new thing as of late are app-based mobile veterinary services. I'm not going to mention any names, but you could get on your smartphone or whatever tablet and get a veterinarian that you don't even know to come to your home. Maybe you're looking at reviews that they have online or something like that, but I feel like the referral is the best way to go because you have this family, friend, coworker that has worked with this vet. They're referring them to you, so you kind of have that level of comfort that this person has been using them, so I'm going to feel comfortable too. Yeah. But I really prepare people ahead of time that the process of me taking on their pet is not just like a 15-minute appointment. It's an hour to 2-hour consultation initially. And I do extensive medical record keeping. So I'm getting all the medical records from in LA or elsewhere where the pets may go temporarily or permanently to live, going through all those medical records, creating a history of my own, asking about all the different aspects of the pet's needs, like where they came from, are there other pets in the household, what's their travel history, what do they eat, how much, how often, what are the treats, how are they pooping and peeing, are they having vomiting, diarrhea, coughing, sneezing, medications, supplements, dental history, anesthetic, non-anesthetic. So there's a whole layer of things that I have to dig through just from history and getting my own info. And then I do a very thorough physical exam. Whatever diagnostics get drawn, like fecal testing, blood testing, sometimes urine testing at home too, if I can palpate a good bladder. And then I send my clients a post-consultation email summary that goes over all aspects of the exam and the diagnostics and the treatment plan. So it's a very involved process that takes many hours on my part, and I'm dedicating huge chunks of time to people. So I try to show them that I'm going to step up to the plate and be there for them in this capacity and continue to help them in the future through email, through help, through text, through phone call, kind of whatever needs to be done.
What I hear there is for our owners who maybe are also feeling rushed through their veterinary appointments, that this could be a really good option. As a veterinary technician, I know most of the time you go into a practice, you have a 15-minute block of our time, right? And that's 5 minutes with our veterinarian, you're going to get that 10 minutes with me. And that maybe isn't what people want. And so this also sounds like a great opportunity for our clients who are like, I just really crave a conversation and I crave learning from my veterinarian, but I don't feel like I'm getting in the practice. And I'm not accusing, because the fact of the matter is they don't have time to do it. And so it sounds like if you really need like a level up, this is a great way to go.
Sure. I mean, the thing is, like, anybody can step into a practice model and kind of abide by that practice model as to how much time you have. If you are doing something more on your own, like I'm my boss. And so I've decided that as a practice, I'm going to create structure around having lots of time to spend with people so it can be very thorough and nobody feels rushed. And it's very much more expensive than what you would get by going to like a corporate veterinary practice, which as a corporation too has lots of resources to be able to put into the whole management. So maybe could offer a lower cost exam or something like that. But you really have to think about the value that you're getting. I mean, do you really want to get the cheapest vet exam around, or do you really want a thorough vet exam that somebody's going to take the time to spend with you and your pet on now and ongoing? And so maybe you need to, it's not for everybody and everybody can afford me, but maybe if you feel as though you want a higher level of vet care, you restructure your finances other ways. Maybe you're not always going to, this is not Starbucks coffee, this is homemade coffee. Actually, it is Starbucks that we purchased through Walmart, but it's homemade. Like I think what we spend as a society on things that are not essential, if we were maybe to restructure some of those costs to more essential things like a higher level of vet care, doing more diagnostics on a regular basis. So you're not, especially with cats who tend to hide their diseases until they're moderate to severe. If you're doing at least an annual exam, blood and urine testing and fecal testing, taking care of dental disease, doing weight management, you can hopefully head off problems before they become more severe and become more expensive to treat.
Sure, right. Okay, so speaking of heading off problems, what are the most common things? You walk into a person's house and you're just like, oh, what are you seeing so much that you're like, this gotta go?
No, probably a bowl of dry dog or cat food left on the ground for the dog or cat to eat at their leisure. That's one thing that totally irks me. I really think pets should eat relatively frequently and not have like huge binge feeding. Granted, biologically, if that cat or dog is roaming around on the plains and they come across a carcass or something, they're going to eat as much as they can until they can get their next meal. But cats or dogs are domesticated now. We need to feed them in a very particular pattern. I like 2 to 3 times a day feeding, or for cats even more often. I have to like tout my good friend Liz Bales' Rock and Phoebe Noble feeding system here. I think it's genius for dry food or treats to try to get your cat engage that prey behavior, hide those little plastic mice all over the household. Love it. So like that's really engaging the cat in a different way to be able to feed. And I think it's so clever and really, really helpful. But then also just when you're looking around it, like I work with a lot of old arthritic dogs, and the stairs are steep and they're slippery. They're sliding all over other floors. They're jumping up and down off of elevated surfaces without using like an ottoman or some kind of intermediary step or a ramp or a set of stairs. So really trying to I try to find the places where my patients could be hurting themselves in the household and really focus on that as much as possible.
Yeah, so that's interesting. So Dr. Liz is a great friend of Basepaws. In fact, usually she makes cats and coffee very frequently. She was with us last week when we talked with Tabitha Cusera about senior cats. And that's just what we talked about was like catifying, or she calls it seniorifying your cat space. And then the week prior, we had Dr. Ken Lambrick on. And if you know him, he is out of Wisconsin and runs a big weight loss competition for cats every year. And we were talking about the Doc and Phoebe's mice. And, people were astounded to hear that he wants cats to eat 6 times a day. Yeah. And we're able to help in the household create those situations and help people see where they could hide and visualize. So I love that you talk about that. And I guess we had that feedback was like, but 6 times a day. So how do you get into the household, find these little things, and then gently mold new behavior in clients, right? Because a lot of it's client coaching, right?
Yeah. Oh yeah, definitely. Have to, I mean, I don't jump right into you're doing this wrong and you're doing this wrong. It just kind of comes up in conversation. That's why we first talk about the cat's medical history, and then we'll look around the house and yard to see what things are concerning. And so I kind of nudge people along the way. I'm a really big advocate of whole food feeding for both my canine and feline patients. I mean, nature just makes food, and then we as a society decide we want convenience and something that's going to be nutritionally complete and balanced in one little kibble or one little portion of processed canned food. And so I'm really a big believer in having food be more in its natural state. I'm a believer in cooked food diets over raw food diets. I know there's a big push for raw food diets, and some pets do great on them, but pets are domesticated, and if there happens to be listeria in that bag of food and it gets on into the household, I've seen whole households get sickened by salmonella and listeria in food. And so it really kind of changes your perspective when you are thrust into that kind of situation that could just be avoided. So it's gently kind of nudging along versus trying to drastically make it. You really kind of want to engage them in part of the process to feel like you're not just telling them what to do, you're making them realize collaboratively that this is just a better, healthier choice.
Yeah, and you can hear my dogs are like, feed healthy food. They are so they're like, this is their favorite part. They're like, talk more about food. Feed me the whole food. They love it. They totally agree. Gary's got a great question for you. So tell us, if we are engaging in a relationship and having a in-house veterinarian come in, what can we expect them to say? We're going to need to get over to the veterinary clinic to do this. What are the things we would expect?
So you mean something that can't be done in the home?
Right.
Okay, so say your cat needs an X-ray, an ultrasound, a CT scan, an MRI, an echocardiogram, which is an ultrasound of the heart. There's those kind of things, surgery. So definitely those initial things can be done at home. Physical exam, generally blood testing, fecal testing. If you can palpate that urinary bladder, I mean, I've been in practice before, ultrasounds are readily available. So if you can palpate that bladder, especially with a cat who has a more pliable wall, you might be able to get a cystocentesis for a urine sample. So more advanced diagnostics. Or I don't really think I don't do intravenous fluids for clients at home. I really think it's best done in a hospital setting where the pet can be really contained well and you can have an IV fluid pump. I do subcutaneous fluids for patients at home. So those are more advanced things that really require kind of 24/7 care. I know of veterinarians that will live in a client's home for 2 days while they're doing intravenous fluids or a blood transfusion, something like that. And I'm just not really set up to do that because I really feel like that medicine is best done in a practice.
Yeah. And that's the part of the trust relationship, right? You say, this is what I don't do. And it's important for folks to understand that is, because it is best practices, because we're fully in it for pets to get the best medicine out there, right? I mean, that's what it's all about. And I love what you're doing out there. I love that you're getting into homes. Any other just tips, resources? Where do you like to send folks who want to learn more about your practice, acupuncture, holistic, vets in homes? Where do you send them?
Well, I think just a really good place for veterinary information is an offshoot of the Veterinary Information Network called Veterinary Partner, where they have vet expert written articles that often are updated in order to, and you can print them out as PDFs there, you can put them on your pad, however you want to read them. It's just a really good, well-researched, well-written resource for clients. In terms of COVID times right now, I'd suggest you go to the American Veterinary Medical Association, or AVMA. They have a great page that really has the latest about COVID in pets. I don't have a strong concern I get this question daily from clients like, can I give it to my dog? Can I give it to my cat? Can I get it for my cat? Can I get it for my dog? And right now, even though we know that cats have tested positive and shown signs of infection, therefore they actually were infected, and people have been infected, and dogs, one, as far as I know, in North Carolina has been infected. It's a very low likelihood, and these cats and dogs have a very high degree of exposure. There are sick people in the household. They are not socially distancing from their pet. They're coughing and sneezing, and potentially infecting your pet. So if you think that you may be sick or you may have been exposed, definitely self-isolate from your pet. Your pet can go to the mobile groomer can come and bathe your pet. That's actually probably one of the best times, because your pet would just have had a shampoo, and the detergent really quickly deactivates the virus and the water rinses it off. Just make sure that your mobile groomer wears a mask and hopefully is not sick themselves. Yeah. But I do think that grooming is important. Some of my clients will not have the groomer come right now because they're so concerned, and so the dogs are all matted and they're trying to bathe and cut them themselves. It's a disaster. But then for other resources, oftentimes local state veterinary boards have a lot of information, like the California Veterinary Medical Board is a great resource. There's one other part of your question that I totally forgot.
Where do they go and get more information, resources, also about holistic veterinary medicine?
So the American Holistic Veterinary Medical Association, the AHVMA. I have a blog on my website that I try to update as often as I reasonably can. Sometimes it's like the last thing I end up doing in a particular day, but you can find me at patrickmahaney.com. My blog's pretty easy to find. So those are probably the places that I would go for information. And then absolutely asking your vet, and kind of going back to how could you find a house call practitioner? If your vet doesn't do house calls, maybe that vet knows of a person who does. And so I would ask them specifically for a recommendation. And if you have that kind of open relationship, most veterinarians not going to be like, oh my God, my client doesn't want to see me anymore. Yeah. And hopefully will understand that they want to have a kind of a different experience, an experience that doesn't require the pet to always come to the hospital. It takes us like a special relationship to do that, but that's why sometimes it does take some time to find that veterinarian that's just right for you.
Yeah, and that's exactly, I think I'm always surprised that people just expect to show up and fall in love with whatever veterinarian, and I wouldn't expect that of my doctor, so I'm not expecting that of my fur kids. You should have a great trusting relationship. And we know when you have that trust, we have better communication, better patient outcomes every single time. So
often communication failures lead to other problems. That's why I actually really like my practice model. Sometimes the amount of text and email I have to deal with, it can be a little bit overwhelming, but people are directly communicating with you. They're not having to call the receptionist. Oh no, Dr. Smith is not in for 3 days. Dr. Moore is going to call you back in 2 days, and you never get a call back. And it's sometimes really challenging when you have a complicated case and you have multiple different vets in the same hospital that might not be experienced with you and your pet to best manage it. So really having that one-on-one relationship is crucial.
Yeah, and it makes all the difference in the world when you're worried. And I know I feel that way as a pet mom when I'm worried about my kids. And it's really valuable to know if you're not having that feeling, then you need to find a veterinarian you have that feeling with. Dr. Mahaney, I'm sure all of your clients have that feeling with you. And I will be blowing your business up with all our Basepaws folks wanting you to come into their homes and take great care of their pets. But more than anything, just thank you for what you do for pets. It's so important to all of us, the education you're putting out there, spending this time here today so that all of our Basepaws folks can just really know that they're doing the best they can for their pets, and they're learning. And so we super appreciate the time that you took with us today.
Absolutely. And I'm actually very excited. I've really only known about Basepaws for a couple months now, but I have a couple kits that I'm going to be using soon. I have a couple target clients in mind, but right now they just want to wait until a little further along before I come to their home to do a wellness type treatment for sickness, of course, but wellness. Sometimes people are seeking to put it off a little bit, but I'm very excited about learning about the DNA results for my patients that I'm curious. So I do have a lot of purebred cats that people get from breeders, and so they're not the target. My cat patients, at least, they're not the target for the test, but I do have some newer kittens that I'm looking forward to testing at some point, and so I'm excited to share those results when they're available.
Yeah, we're going to have you back. We want to hear more about it, and make sure you're sending all of those kitties that need a little extra time over to Coach My Cat. That's what we do. We can get that education in, help them understand their spaces better, help them work through all that information you get. Make sure you guys are following us on Instagram at Basepaws. Make sure you're following our Facebook. You can follow me at Coach Beckie over on Instagram. If you guys are ready for this week's Basepaws challenge, you guys will head over to Facebook right after this, and there'll be more information. And we're actually going to see more of you soon in the future, right, Dr. Mahaney?
Yes. this Sunday, I think it is, on my calendar. Definitely, it's plenty of time blocked off. Yeah, we're going to be talking about periodontal disease, amongst other things. Very important topic. Probably the number 1 and 2 diseases I see in all pets are periodontal disease and obesity. So they're both completely preventable. And also, if you don't prevent them, they become challenging to manage and can have life-threatening consequences. So it's really crucial to focus on daily home dental care.
Yes, that's exactly right. And so you'll be over there on with Dr. Chris having that webinar on Sunday. So make sure you guys are checking that out. Dr. Mahaney, we're going to catch up with you again really soon. I want you to stay safe out there. And thanks again for all your time today.
Doing so. Thank you very much.
Thanks, guys. Bye.